Hi everyone, it's Kate Parker, and I am facilitating this week's discussion of evidence-based practices in special education. So before we dive in, I wanted to give a historical perspective. The mandate for evidence-based practices came out of the No Child Left Behind Act. At that time, there was strong support in the educational community for sort of making more equitable the learning experience of students, regardless of school district, state, or special education classification. So the hope was by implementing evidence-based practices, we could help students with disabilities improve their academic outcomes by increasing our expectations for these kiddos. The guidance for evidence-based practices came about because of concern over how different school districts and states would manage this process, and mainly because there was a lack of knowledge of effective interventions and strategies. At least within the practice domain, we know that a lot of these strategies have been evident in the research for a long time, just not making that research to practice link. So the same mandate created the What Works Clearinghouse, which is a database of evidence-based practices. And the great thing about that is it's accessible to educational stakeholders, so teachers can, look deeply into the strategies they're implementing in their classroom to determine if, the research supports that these have, been beneficial in increasing educational outcomes for kiddos, instead of just the spray and pray method of applying interventions in school. So there is a lot of muddiness around terminology in this domain of education, which is not so different than education as a whole. So the authors of our articles this week, sort of the consensus was that evidence-based practice encompasses the programs and practices that are shown to have meaningful positive effects on students, according to research studies, and this is the kicker, with strong methodological rigor. So that is broken down by research design, the quality and quantity of research, and meaningful effects. Cook and Cook further distinguished between evidence-based and research-based practices, saying that evidence-based practices must establish causality, and we'll talk about that a little bit more when we talk about research design. They must address the rigorous indicators of methodological quality, and there must be multiple studies. We must see that there's a replication effect, that if I use this strategy with a different group of kiddos, I can expect the same result. And it must meet the prescribed level effect, so the same intensity of the result. So we'll talk about each of these considerations as we move through the presentation. Okay, so in terms of research design, there are 3 acceptable experimental designs for determining research-based practices in special education. You will notice you don't see correlational designs here. Correlation cannot determine causation, and we are interested in knowing if an intervention caused an improved student outcome. So within the field of evidence-based research, these are the 3 acceptable designs. The first being the group experimental, where we have at least 2 groups, the intervention group or the treatment group and the control group. We prefer random assignment, and we can determine causality. A group quasi-experimental design just lacks that random assignment. Sometimes random assignment is, unfeasible. So as long as the other, aspects of that design are followed through with fidelity, we can still determine causality. And then single subject design, which is also called single case studies. So an individual participant, sometimes there's a few participants are the recipient of the intervention, but it's not a group experiment. It's still individual, even if there are a couple students in the study. And so there's no control group for comparisons. And so we determine if there's a strong effect by the replicability, by applying the intervention and withdrawing it and seeing how the student performs in those different conditions. Okay, so now in terms of the quality and quantity, so quality indicators for the different designs in special research designs in special education looks at things like describing the participants, the implementation of the intervention, and the description of the control condition. We want to make sure these things are clearly described. We want to make sure that the fidelity of the implementation is in place. We want to see multiple measures of outcome so that we can determine if these effects can be generalized. And then we also want to make sure that the data analyses techniques are appropriate for the hypotheses and that we're calculating effect size. Those are the essential quality indicators. The desirable quality indicators include looking at things like attrition, reliability, so looking at that internal consistency, the test-retest reliability, and then inter-rater reliability, all things that affect the quality of a study. We want to look at outcomes for capturing that effect beyond that immediate post-test. So is this effect, does it exist kind of more longitudinally? If we went back 6 months later, would we still see a significant benefit with the use of this intervention? We look at things like construct validity, the quality of the implementation. Again, that's the fidelity, the documentation of that control condition. And another desirable quality indicator is if the research report includes audio or videotape excerpts of intervention, which I've seen a lot with single subject design. I can't say I really investigated that with the other two. And then, are the results presented in a clear, coherent fashion? And then in terms of quantity, when it comes to evidence-based research studies, we want to see multiple high-quality studies. So that replicability comes in here. And Gersten et al. Suggest 2 quality or 4 acceptable quality group experimental and quasi-experimental studies within the greater research database. For single subject research, we want to see at least 5 high quality single subject studies across 3 different geographical locations and by different researchers. And we want to see at least within those 3 studies, 20 participants. That's according to Horner et al. 2005. And that's again, so that we can say, okay, if I use this intervention in my school, I can expect the same results. I can generalize these results. Harder to do with fewer participants, right? In terms of meaningful effect, Hornby suggests that the average effect size for all educational interventions is 0.4. So then anything greater than that we can say is above average in terms of its success or whatever. So the effect size is essentially the measure of the change following an intervention. And if you look here, we can see that formative evaluation has a very strong effect size, student-teacher relationship. And what is interesting to me is that, looking at student-teacher relationship, boasting one of the largest effect sizes of all of our evidence-based interventions, and thinking about some evidence-based programs that I've used, Check and Connect out of University of Minnesota, and the check-in and check-out procedures, Renew out of University of New Hampshire, they all have very strong relationship components, and we're looking at using those with Tier 2 or Tier 3 kiddos. So that's positive. But I think that might be a surprising finding to some teachers, realizing the power of that relationship. I mean, we see that has stronger outcomes than homework. So, but homework, I would say, is more pervasive than specific strategies to improve student-teacher relationships. So just interesting. Again, some additional evidence-based practices in special education. It's important to note that these are strategies. They're not packaged programs, but they are often a part of the packaged curricula that you'll see in your schools. So mnemonic strategies has an effect size of 1.62. That blew my mind, but certainly, lend support for using those in our classrooms. Behavior modification, which is really rising in implementation in our schools, which is very promising, and direct instruction, again, clearly a component of some of the packaged programs that we use. But we do see that several practices lack meaningful effects, so they have low or no effect size, and they continue to be implemented today. Things like retention. I'm working with a school right now who said, wow, last year we retained 9% of our freshman class, 9%. And this year, because they implemented Renew and Check and Connect, they only retained 3%. But still, that seems way too high for me when we know that there's no support for that practice in education, but we still do it, right? Social skills training is another one. And as a school psychologist, having that often on my plate is a real frustration. Again, gets at that research to practice link. So I've included here some repositories of evidence-based practices for you to explore. Our assignment this week, you'll be assigned to one of these, but just for future reference, these are all some nice websites that contain practices and provide the evidence base for those practices. So some considerations regarding evidence-based practice. Clearly, implementation fidelity is huge. So if I see that, behavior modification has a really strong effect size, sorry, my neighbor is mowing, good timing, but I'm not following, the FBA protocol correctly in my school, or I'm not following a student's behavior intervention as it was outlined by our BCBA, well, I can't expect the same results, right? Another consideration is non-responders. So we think with evidence-based practice, we have the highest likelihood that we'll experience better outcomes for students, but we will still always have those chronic tier 3 kids, those kids that they're not responding like we would hope. So we just have to continue progress monitoring and continue that problem-solving process. And then barriers to evidence-based practices, those traditional beliefs and about practices in education. Most teachers consult veteran teachers, not research. And there is skepticism with regard to evidence-based practices because veteran teachers have lived through wave upon wave of, quote, evidence-based practices. And Burns and Eiseldike argue that this contributes to the research to practice gap since we have abundant research studies regarding effective practices, but we're just not seeing them rolled out as we would expect. Essentially, personal beliefs trump the research data. And some studies have even shown an inverse relationship between evidence-based strategies and teacher acceptability per Burns and Eiseldike. And then there's the other obstacle is the spray and pray approach. So, we give teachers a one-day PD on a strategy and we say, go forth and serve. But there's no review, there's no reteaching, there's no fidelity check. So all things to keep in mind if you're supporting teachers and rolling out some evidence-based practices. Okay. That's it for the lecture. So I just wanted to review our outline. You're almost done with the lecture. You had several readings this week. Two of them were required and one was a skim. And then the discussion board activity and posts, you can check that out for more information. Again, you don't have to explore all of those databases. You are just assigned to one and you can report back with your findings. And then Dr. Correa Torres was going to provide an IRIS model on evidence-based practice for us to explore. Okay, here are the references for my presentation this week. And I hope you have a lovely week. Looking forward to our discussion. Bye-bye.